Assalamu alaikum wa rahmatullahi wa barakatuh. Today we'll be talking about malaria. You're surprised? Well, you shouldn't be, because malaria is very common. Almost every one of us has malaria at least once in a year. We all know it's transmitted by the bite of a mosquito, but what actually is in this mosquito is the Plasmodium organism. Once a mosquito bites you, the organism is extruded into the bloodstream, runs its course for about 10 days or more, and then you begin to have symptoms of malaria, which usually are fever, that's a high body temperature. Sometimes you have joint pains, sometimes you don't feel like eating, sometimes you have chills, and you generally just do not feel very well. Now, we need to talk about malaria because I've heard a lot of people talk about it and say, oh, the patient just had a simple malaria and he died. There's nothing simple about malaria. It's a very deadly disease. It actually kills faster than we all think about it. Malaria is said to be responsible for more than 1 million deaths per year. And even as we're speaking now, a child is probably dying in the hospital because of malaria. So what should we know about malaria? The first thing to note about malaria is that we need to, once we find that an individual is not feeling so well, the person has to go to hospital. Do not think you can stay at home and just treat malaria with this herb or that drug and that. No, malaria needs to be, especially if it's a child or the elderly, they need to be properly diagnosed and properly treated. Why? Because there's so many complications of malaria that we need to avoid. The first thing a child usually would succumb to is anemia, because once the organism gets into the bloodstream, it destroys the blood, gets to the liver, destroys the blood cells, and then the child becomes anemic. Most of them succumb to malaria because of the anemia. Again, you could have an individual who could have renal failure from malaria. I will not go into how that can be. Could have black water fever, but the one that we generally all do know about is cerebral malaria. This is when the malaria parasites has gone into the brain, especially in the child or those who are just coming into the country, the non-immune against malaria. Malaria is also deadly in pregnancy. It affects the placenta and has been known to cause so many stillbirths and abortions or preterm deliveries as well. So it's not a disease or an infection that we need to toy with or that we can afford to toy with. How do we prevent malaria? Very simple. We just need to target those areas in which the mosquitoes breed. All those pots and pans that we throw around the houses, the tins that we have around, these are areas that can collect, these are things that can collect water. And in this still water, the mosquito can breed. The drainages around our houses need to be kept flowing. As long as the water is flowing, the mosquitoes cannot breed. The grass around our houses must be kept low. And within the house, we need to be sure that we use insecticides. These will last long because once the mosquito is on the wall, the insecticides are already there and they can deal with it. When we do come into contact with mosquitoes, the first thing to note is, oh, I'm not feeling fine. Get properly diagnosed and ensure that you take the medication. Do not just think that malaria is simple. There's absolutely nothing simple about malaria. And in this environment of the tropics, we can be sure that mosquitoes always abide. That is not to say that malaria only affects us here, because sometimes when we travel around, we carry in our bags the mosquitoes, and then of course you could have it also outside the country. Anywhere that has the same kind of temperature, the climate that we have here, they also have mosquitoes. So be sure to protect yourself with protective clothing as well as insecticide-treated nets, and once you are done with it, get properly treated. See you next time. Assalamu alaikum.